Hello everyone. In series of learning, we have came through many milestones, and today we are covering the topic of breast cancer. I myself, Kada Pinky, and I'm here with Mr. Pranav Prakash sir and the HOD of GD Goenka University. Namaste sir. Sir, we have many questions regarding breast cancer, and first of all, we have to know what is breast cancer and how it was caused. Everyone in our channel would like to know what is breast cancer.
So first of all, let's start with the topic of cancer itself. What's cancer? So our human body is composed of millions and millions of different cells, and the cells grow in such a way that cells are in perfect harmony. They are working together and are absolutely functional. Sometimes when there is an anomaly, then some of particular cells, they start growing unchecked. That means there is an uncontrolled growth. When we say uncontrolled growth, then they start grabbing nutrition from other places, and they grow in such a way that they are not just localized, but sometimes they can go to different locations within the body itself, which we scientifically call as metastasis. So potentially, every human tissue in the body is capable of growing beyond control, and once it is going beyond control, it is cancer. Now, the cancer related with breast is breast cancer. As the name suggests, it's mostly in female, mostly later age group female, but still some younger girls also are getting affected, and also in some of the rarer cases it can also happen in male patients, but distribution is mostly in female and mostly in later age group.
Sir, then what were the signs and symptoms of this disease?
Yes, a very important question, and especially all the people through your channel should know that this cancer is unfortunately absolutely painless to start with, and that's why even despite the care is available, very good treatment options also are available, still many times we are losing patients, or we are getting patients at later stage of cancer only because most of the time it goes symptomless. Now, if we say it is symptomless, how to detect it? So all the organizations, and apart from that public health initiatives and doctors, gynecologists, oncologists, they all are promoting now breast self-examination process. If you go to YouTube or if you go to public health campaigns, you can find how to exactly go about it. It is very simple way of examining oneself, and it can be done in absolute privacy of one's own place and by the patient herself, by every individual woman. So it is easy to conduct process, anyone can learn it, and by identifying any kind of lump or any kind of hardness, if it is there, we as doctors always suggest you do not ignore it. Still, scientifically speaking, most of the times it won't be cancerous. I also like to dispel the myth that any lump or any hardness in breast tissue can be cancerous. No, most of the times rather, the lump or the hardness or any kind of abnormality that we find in the tissue is not cancerous, but sometimes it can be. And that's why individuals, if they find any kind of abnormality at the time of self-examination, better they should seek the advice or opinion of oncologist, or you can meet your personal family physician, so that way we can detect the disease in very early stage. And apart also from that, there is again a very simple and a very painless process that's called mammography, where exactly it's a radiographic process where the breast tissue is radiographed, and again it is very simple process, one very easy process too. It can be conducted in a very quick fashion. That's why now you can see a lot of organizations, lot of CSR foundation, hospitals and public health initiatives. We are having large camps where women are encouraged to go for mammography. So mammography can also detect any cancerous development or any abnormal growth at a very early stage where it can be treated in a conservative manner.
Thank you, sir. And I would like to ask, like, as a being a girl, I have came through many series of like these kind of cases. Usually, women will think that if they got some pain or some hardness, as you already mentioned, they will think that they are getting some breast cancer. As nowadays, it was like we are seeing multiple of cases. Of course, not everyone is diagnosed with the same breast cancer, but still, women are having some kind of a fear if we go for the diagnosis, and if we got the breast cancer, then we would like they will cut off the part, or they will destroy my structure or something. So every woman is having some kind of fear in them. So what you will suggest, like, to get over it and come to the diagnosis and come to check and everything?
Yeah, so let's answer the question in two parts. One about the fear. So any cancer, we all are human beings. So any disease, it's very natural to fear the disease because disease is not a normal process. But there are certain diseases for which treatment is not available. There are certain also diseases which hardly allow enough time to take care of the patient. But there are certain other diseases where if we are able to detect at an early stage, it's never life-threatening. Number two, we have very good care for the patient. Unfortunately for population, now breast cancer has reached with scientific advancement to a stage where one, we can detect it. Now we have means to detect it at a very early stage. As we discussed about breast self-examination, it's again a very simple process as we discussed. So girls can go for it. Every month, if you at least go once in a while, you can detect any early development. Beyond that, mammography is also suggested once a year, or you can take advice of your oncologist or family physician. Through your channel, I would also say, if your family physician suggests the frequency should be a little more, you can go for it. Otherwise, once a year is enough, because exposing oneself to radiation also has got certain other problems. So the first line of examination is through self-examination. The second line is through mammography. Beyond that, I would like to assure women through your channel that it is not life-threatening, number one. So that way, it's not a condition that if you are diagnosed with it, there is certain stamp of death. Number two, about cosmetic concerns, which are again very important concern for girls and women, because it involves emotional makeup and psychological well-being. So it can also be added over here through your channel that now a lot of prosthetics are available, which makes prosthetics in such a way that the loss of tissue is not really visible, and well much advanced prosthetics are available to help the patients who are affected with breast cancer. So even if a patient loses the tissue, still the prosthetics will be taking care of their emotional makeup. So a lot of this kind of counseling also is available at oncology center. So all the oncology centers are now well equipped to handle and advise patients what kind of prosthetics to go about, what kind of plastic surgery they can go with. So we have different multiple options to help the patients who are affected with breast cancer. And in the worst case, though such kind of drastic surgery has falling in percentage, we are having less and less number of women who have to go through drastic process of reduction or drastic process of loss of tissue. So that way we have lot of medical options available at the center of oncology. So through your channel, I would suggest all the women viewers who are looking, many options are available, and if you take advice of your oncologist, you have multiple options where your aesthetic or your appearance won't be affected, and which will not lead you to emotional problem or psychological issue.
Sir, coming to like this was a bit challenging when compared to the other cancers or other like when differentiating from men and women are also having the menstruation. So how the menstrual health will be affected if they are found to be a patient of breast cancer?
as we discussed, it's a complicated issue, and what kind of treatment process a woman goes through when she is getting treatment and management for breast cancer. On that only it will depend what happens really to her menstrual cycles or further reproductive health, if I'm understanding the question well. But we also have a lot of different options, even reproductive assistance, egg freezing, and other different processes also there. And as we suggest, if we increase this awareness and education at large extent to larger community, we hope to correct and detect the cases very early on, where we don't have to go through a very drastic treatment process. So her reproductive health or her emotional health, aesthetics won't be disturbed or altered a lot. But still, I would suggest in these cases, the patient needs to take advice from her gynecologist and oncologist together, so that understanding all the options well and choosing in a very informed and educated manner what different treatment process to look for.
Sir, we already came through all screening process and also diagnosis, how to treat them. But my question is there any permanent treatment for it? Like, what was the treatment to get preventive or curative method in breast cancer?
Wonderful question, especially talking about prevention. So the thing is that there are certain factors which make a woman or a girl vulnerable to breast cancer. One of them is obesity, which is a very common cause, and it is being attributed scientifically in different public health research papers. Then it is certain hormonal treatment, if she is going through hormonal treatment in her for her other medical condition. Apart from that, consumption of alcohol is also a source of increasing the vulnerability. Smoking also has been attributed. Pollution also is attributed towards this. Certain genetic predisposition is also there. If patient's maternal side or father side, if women were affected by breast cancer, chances increase a bit. And there are certain mutations also which are attributed. So a person can go for can go for certain diagnostic testing also, molecular testing, where the patient can find out whether the patient is vulnerable or not.
Sir, one last question. Like, if we do the early diagnosis and if we take the preventive measures and all, it is okay for the individual patient. But my question is, what will be the family role in this? Because the mental health also mainly matters. So every woman, even though we get a small disease, also we will be judging by many in many perspectives. So what should be the social or the family status on reacting on it?
Yeah, I understand. For every woman or any person, if he or she is affected with cancer, it's a kind of life-changing emotional trauma for them. But as we discussed, the families should know what are the options available for counseling. The patient should be guided to get better treatment from, and the advisory should come from, as we discussed, gynecologist, oncologist, your family physician. Psychological counseling many times can also be needed. So life partner, if she is married, he will also be in a great position to overcome this and also to support and encourage. And alongside the life partner, the complete family should come together and provide support in a sense of being together. So that's going to really help.
So you're saying that with the patient, even the family also should be counseled, sir?
Exactly.
Thank you, sir. Thank you so much. You have given us wonderful knowledge regarding breast cancer, and we are so glad to meet you, and I was so thankful for you again. And by this channel we came to know that why every woman should come out and take a diagnosis test or screening test, which is, as sir mentioned, the self-examination is the key. It can be easily available, as sir mentioned. So it's not a big deal to come out and take diagnostic tests. Every woman by this channel and through our channel should know what the basics of the breast cancer. And we are so thankful for you, sir. You gave us very wonderful time and you gave so much knowledge regarding this. And thank you, sir. Thank you once again.